Hello, my name is Barbie Cunningham, and I am a nurse practitioner student at West Texas A&M University. And this is a research presentation on identifying influenza and the best treatment for different patient populations. Um, so, in the primary care setting, it's very important for the providers to know when to treat flu, and the best way to know when to treat it is know when to identify it and how to test for it. Um, so, patients that come in early, so when symptoms start within 24 hours or 30 hours, it's best to, that's when you begin treatment protocol, but it's not approved for the medications to be given if symptom onset is greater than 48 hours. So it's important for us to educate our patients on one, getting a flu shot, proper hygiene during flu season. So make sure you wash your hands, cough in your elbow so that you're not spreading germs to other people. And then if you do get the flu, start having symptoms, to come into the clinic early. So symptoms of uncomplicated influenza include fever, headache, myalgia, malaise, cough, sore throat, and rhinitis. Once you determine if your patient has these symptoms, you're going to determine if you need to test based on when their symptoms started. So the test will determine if you're actually going to treat them or not treat them. So if they're out of the 48-hour window, there's no need to test them because you're not going to be able to treat them anyway. So the test is a nasopharyngeal swab, and it can tell if they have flu A or flu B, or if they don't have it, because there's a control aspect. So you know that it's negative. If none of them show up, then it's an invalid test and you should test them again. Um, the most popular treatments are Tamiflu, and Zofluza, or the alternative medication, oscillococcium. An important part of patient education while treating the flu is the lifestyle. Treatments include drinking plenty of fluids to prevent dehydration, resting because increasing sleep can help your immune system work more efficiently, and then fever and pain management with those body aches helps. With over-the-counter medications, Tylenol and Motrin are recommended. For children under 6 months, you don't want to give Tylenol, so you want to warn parents about that. If they have older kids and they're used to alternating Tylenol and Motrin, you want to warn them they can't give Motrin for a kid under 6 months because of the kidneys. We don't want to harm the kidneys while they're still developing. The first pharmacological management, Tamiflu, it is active against A and B. It is recommended treatment for kids greater than 2 weeks old, or pregnant women or breastfeeding women. It is given, like an adult dose is 75 milligrams PO twice a day for 5 days. That 5 day, twice a day aspect with some of these patients helps kind of complicates things, because if they start skipping doses, then the virus can become resistant to the medication. So you want to watch out for the potential of resistance. If they had flu and this is their second bout of flu and they're trying to get the medication again, you don't want to give Tamiflu, because there's a good chance, if they didn't complete twice a day for 5 days, that they will be resistant this time if they got it again. The cost is roughly $160 without insurance or a coupon. So if insurance and or they have insurance or a coupon, it might be a little bit cheaper, but you just want to be aware of that. The side effects include confusion, agitation, self-injury, rash, itching, swelling, and dizziness. The self-injury aspect, we want to warn patients, their family members, and like parents of children to watch out for that aspect, and to seek medical help if they actually are injuring themselves, but just monitor them closely. Second pharmacological management of influenza is Zofluza. It can treat influenza A and B. It's a single dose treatment of if the patient weighs less than 80 kilograms, 40 milligrams. If the patient weighs more than 80 kilograms, it's 80 milligrams. So based on their weight, so you definitely want to get their weight at the clinic. And it's really awesome because it's only one dose, so they can't really become drug resistant. It helps alleviate symptoms by approximately 1 day. So it works really fast, effectively. But some of the side effects are trouble breathing, which if they already have a cough or they have pre-existing medical conditions that can exacerbate that. Skin rash, hives, blisters, swelling to the face or mouth, and dizziness. So swelling to the face or mouth, that can be a severe reaction, close off their airway, and complicate their breathing. So you want to warn those patients if they have those severe allergic reactions, then they definitely need to go to the hospital. Our non-pharmacological or supplement is oscillococcium. It's a combination medication, homeopathic. It is not FDA approved. There's not very much research on it, so that there's no real list of side effects. A bonus to that one is it can help alleviate some of the symptoms, or be used as a preventative medication. Supplement, not medication, supplement. But it's not proven on if it actually helps you get over it faster, or just relieve some of the symptoms. The cost is about $10 for 6 doses or $35 for 30 doses. They can take multiple doses a day, but not exceeding 4 doses in a 24-hour period. The high-risk patient populations, these patients include patients over the age of 65, pregnant women or women breastfeeding or postpartum women within 2 weeks, long-term care facility residents, patients with a BMI greater than 40, immunocompromised, and patients with chronic lung disease, chronic kidney disease, chronic heart disease, and chemotherapy patients. They can be treated with Tamiflu or Zufloza, Zufluza, in uncomplicated cases, but in complicated cases, Tamiflu is the treatment of choice, especially when they're in the hospital. But once again, really need to determine if symptom onset started within 48 hours. They might go ahead and treat them if they're in the hospital to try to help them get over it, but that's not recommended for the general patient population. The high-risk individuals are very susceptible for complications like dehydration or pneumonia. Those chronic kidney disease patients, if they get the flu, then it's really hard to tell them to push fluids because they're already on fluid restriction, and then they feel bad, so they want to skip their dialysis treatment, which makes them feel worse in the long run. So we just need to monitor those patients. Patient education is very important, that they can seek help as soon as they start feeling really terrible or they spike a really high fever, because it's very hard for them to just take medications and not get complications with stuff like the flu. So the pediatric patient population, the FDA recommends Tamiflu for patients older than 2 weeks. So we want to protect those newborns by allowing the pregnant mother, if they're going to give birth during flu season, definitely recommend they get the flu shot so that they can help prevent them getting sick and in turn getting their baby sick. But the pediatric patient population is very high risk for dehydration, so we want to push fluids and have the parents encourage them fluids, drink different fluids in small amounts, mix it up, give them water, give them Pedialyte, give them juice, give them Gatorade, half strength Gatorade, half water, half Gatorade, just to make them stay hydrated. Encourage them to eat popsicles, just to keep their fluid levels up. It's way more important for them to stay hydrated for the few days that they are sick than for them to eat. If they eat, great. If they don't, make sure they're drinking. It's just very important for us to educate our parents when the kids get the flu, and encourage them to get the kids the flu shot. It will help them, one, maybe not get it, and if they do get it, maybe help them get over it a little bit faster so the symptoms aren't as severe, because we definitely don't want these little ones in the hospital. Hospitalization in children under 5 years is 42 to 74 in 100,000 kids. Hospitalization from ages 5 to 17 is 10 to 20 per 100,000. So not super common, but we definitely want to educate our patients because we don't want those kids to fall through the cracks and get even worse. We don't want to prolong the illness or them to have complications. Like some of the pediatric complications are otitis media, pneumonia, croup, or febrile seizures. Educate our parents on the potential for seizures when the fever gets really high, really fast. They want to control the fever with Tylenol and Motrin, except for in those little kids under 6 months old, only Tylenol. Educate the parents based on weight. They need, with Tylenol and Motrin, 10 to 15 milligrams per kilogram. So while they're in the office, we can give them the dosing chart, tell them how much their kid weighs right now so they can get the proper dose so that the patient can fight the fever without potential for febrile seizures. We want to get them the right dose. We definitely want to educate them on hand washing. And little kids are really hard. We don't want to take them to daycare with the little ones because, like everybody's touching everything. They're snotty all the time. So it's very easy for flu to just go through like a full classroom of little ones because they can't keep their hands washed enough when they're sticking their hands in their mouth and touching all the toys and everything like that. So early recognition or early recognizing symptom onset, early treatment, and then keeping those kids home away from other people is the best alternative for keeping the in general population healthy. This concludes my presentation. Thank you.